Hello, this is Dr. Rajesh Yadav. I am an associate professor in Department of Psychiatry at Dr. Kumar Dhawale Homeopathy Institute, Mumbai, Palghar. So today I am here to answer one of the questions which was received from Dr. Shilpa's survey through her academic online academic which she runs across. So the question is very important and very interesting also. Question which is this which methods are effective in establishing rapport in a reserved patient. So it's very important, how do we talk and communicate with the reserved patient, shy patient, or a patient who are not very communicative to get valuable information and data for our homeopathic prescribing. It's very important for us to create that safe and non-judgmental environment, so that these patients do not perceive that they are being judged in any way. So when they can feel that they are being judged in any ways if they observe certain types of behavior, certain facial expressions, certain questionings from the physician itself, that can makes them perceive that they are being in a judged state, we have to create the environment where the confidentiality is maintained, and we need to keep all the confidentiality of all data which we are going to receive. Another important aspect is the observation. Observation is very important and key aspects while dealing with patients who are very reserved and shy, because all those behavioral and emotional facial expressions are important for us to consider and use in homeopathic prescribing too at times. Silence is very important. We need to give time and be comfortable with the silent. Even from the patient side, if they are silent, non-communicative, we need to be at receiving end and allow them to express as and when they want it to be. That will make them more comfortable and well received at that is what they would perceive it as also at certain cases. It's important for us to not rush that patient is speaking anything. We need to at times certain limited expressions, like sometimes like we communicate with friends and family, even with patient, okay, certain nodding of it. All these gestures are very important for them to communicate with patients, so that they are feeling being received and non-judgmental, so that they share their stories and history as open as possible. And the non-verbal communication at times is important, where we can ask them to write, note certain poem or drawing or painting, saying that whatever is happening to you, whatever you wish to openly, if not openly able to talk about, please write it down, draw it, write in poem form or any other ways which they are comfortable. That will allow them to express more as opposed to the verbal communication. So at the very end, that it is important for us that every patient has a story. Our job is to patiently invite that story to us, so that we can use that story in form of homeopathic data and try to understand the individual and give a suitable homeopathic individual remedy. Thank you, and hope this question is been answered. And some of its aspects are dealt in one of my case, where our personality chapter, I have dealt with that case, and the components have come across in that case. So once you enroll in the study and find that chapter and that syllabus, then you'll understand it. Thank you.